My name is Fran. I'm with Sweet Serenity Massage and Self Therapy. And today what I wanted to do was introduce people a little bit more to craniosacral therapy. Craniosacral therapy is very light touch. It's very good for just basically whole body wellness. Actually developed by a gentleman by the name of Dr. John Upledger. During the late 70s, early 80s, he did a lot of research and came up with a protocol which is like the basis of craniosacral therapy technique. We don't always do exactly this 10-step protocol that he came up with. We kind of go with the flow as to how the body is reacting to our touch. So a little anatomy for you. Basically, the central nervous system of our body has great impact on all of our systems, but the craniosacral system has a big impact on our central nervous system. So it is made up of all the membranes that surround the spinal cord, as well as the brain, as well as all the fluid that helps to lubricate all those areas. And that fluid actually moves up and down our spine. So when it moves up and down, it kind of creates a rhythm. And we as therapists can kind of feel that rhythm, and sometimes we can tell areas where it might be a little bit slower, or a little faster, or a little more intense, or not so intense. And it's with those signals that the body is telling us where it wants us to go. So what I'd like to do now is just kind of do a little brief demonstration of how we get this started. And we're going to start down at the feet, and we're going to work our way up. So I'd just like to show you how we begin one of the craniosacral therapy sessions. It's important for you to know too that actually for this particular type of situation, the client does not have to undress. They can lay directly on top of the blankets. We put them under the blanket only because that'll keep them nice and warm, but that does not have to be that way. So just so you know ahead of time. What I'm going to start with is some therapists can actually view the body completely, and they can actually see and visualize those spots that might be hot spots, we call them, where they know they're going to have to require a little extra attention at that point. But just for demonstration's sake, we actually do touch the client, but the weight of our hand on your body is not more than like a nickel resting on your hand. So it's very light touch, and we just kind of concentrate and wait till we can feel that rhythm. Once again, if it's a little faster or slower, we know whether it's someplace that needs more attention or does not. And we will do this kind of thing at the feet, at the knees, and at the hips. Now that's my normal process. Other therapists might do it a little bit differently. I will proceed then up and right at the chest and at the shoulders. I'll be doing the same thing, just like holding and feeling the rhythm. The body kind of helps us realize where it wants the attention. Body likes to self-heal. So once we feel an area that feels like it needs more attention, then we might actually feel a little bit of movement of the tissue under our hands. So some kind of circular motion as it's trying to release. Sometimes we'll feel an extra amount of warmth there, so we know that's where the body wants us. Sometimes the body just kind of pulls us in, and it just wants us to hold, and just hold that area for it while it tends to self-heal. This is not a fast process. Sessions can last as long as 60 minutes. Sometimes I've had sessions that lasted longer than that. It really depends upon how the body and where the body wants us to go. So I'm hanging out here at Donna's hip and upper leg because right now I'm just feeling that it wants me here. It's holding me, and I will stay here until it lets me go. So as you can see, this can be very slow processed. I've only just begun, and I'm already sitting right here. So the body finally left me go off of Donna's hip here. What I like to do also is when we're scanning the body and we're going at the different levels, looking for the rhythm, I like to do a release. We discussed the fact that the craniosacral system is made up of the spinal cord and the brain tissue. So what I like to do is release that whole area. So I will actually go under the patient's back, the client's back, I should say, so that their sacrum is actually sitting in my hand here. And then I will put my other hand underneath their neck. So I'm right here at the base of their skull. And I will just kind of listen and feel for that rhythm or that flow. This is kind of like what they call the craniosacral rock. Just like you're rocking a baby, but you're just listening for the rhythm. Sometimes the body will actually stop just a bit as it tries to relax and stretch that area out ever so slightly. Occasionally, people will feel a bit of a pulsation at one of my hands, whether it be down by their sacrum or up by the base of their skull. And basically that is just representative of a therapeutic pulse. A lot of times that occurs as tissue is trying to release and relax. Craniosacral therapy is great for tension and stress. It's great for people who have chronic headaches and migraines. It's also very beneficial for people who have like fibromyalgia. A lot of clients with fibromyalgia really don't partake in regular massage because sometimes the massage can intensify their situation as opposed to help. I have clients at both ends of that spectrum, some that really want me to really do deep massage, and then other people that want me to barely touch them, and others that don't think they want to touch at all, but sometimes craniosacral can be very helpful for that, especially if you don't like a deep touch. Feeling a little pulsation at the sacrum. I don't know, Donna, do you feel that at all? Craniosacrals, it's not like a regular massage where you can follow a specific protocol. We've been taught what they call a 10-step protocol in our training. I've taken additional types of classes too that kind of help me figure out what the body might be telling me. But in all craniosacral therapists will do things a little differently. It's not like a set way of doing it. And it doesn't mean that one is better than the other. It's just some are more helpful to some clients than other ways of doing it. So I don't want you to think that we at Sweet Serenity, that this is the only way that it can be done. This is just how we do it here. After we've kind of scanned the whole body, then we'll come up to the cranium and just kind of work here as well. I usually start down by the base of the neck here. Once again, it's very light touch. I'm barely touching her. I just kind of wait for signals from the body as to what's going on. I always tell my clients that they might actually feel my fingertips moving, and if they do, then we're just moving with the tissues of the body. And I will stay there at any point in time until that movement is completed. That just represents like a release or relaxation of that tissue under my fingertips. Some people, well, everybody's going to have a different result from a craniosacral session. Some people just feel a new sense of relaxation. Other people have actually had emotional reactions to this as well. And people will start crying during a session and they apologize. And I always tell them, do not apologize for crying, because that is probably the best release the good Lord ever gave us. And just let the tears flow, because that's helping to release something. Sometimes we can hold memories for a very long time, and sometimes it just takes us a time to actually sit and relax and just get rid of it. We'll just kind of wait here. I am going to do a release here at the cranium, base of the skull, in just 1 second. I like to include some of this craniosacral stuff in my regular massage. My clients don't necessarily know that that's what I'm doing, but it is very helpful to relax muscles and the overall body. So I'm just going to hold Donna's head in my hands. I'm going to put a little bit of pressure here at the base. And sometimes, and like I tell my clients, it's just going to be a little bit of pressure for just a couple of seconds. They might feel some movement. They might feel some pulsation at my fingertips, and if they do, that's normal. It's just a little therapeutic pulse. I'm kind of going through this pretty fast. This is a very slow process. Sessions, like I said, can last 60 minutes. I've had sessions that lasted longer than that, depending upon what's going on. I don't consider myself like doing anything. Basically, I'm just acting as a facilitator so that the body can actually do its own self-healing. So I'm feeling some pulsation here. I'll just wait till that relaxes. I would continue on by just holding my hands on each side of her head, and then just once again just go to different areas that I'm kind of drawn to. This is also very good for TMJ syndrome. There is a protocol that it can actually be helpful by feeling the structures basically inside the mouth. Not something many people are agreeable to, and I totally understand. So like I said, I would just proceed by checking out various areas of the cranium. We can sometimes feel movement as the body's trying to relax and release the tension. So obviously I would spend a lot more time here than I would the rest of the body, because between the temporals, the TMJs, the neck, and the shoulders, that's where people carry most of their tension, so I would spend most of my time up here. Like I said, this can be an hour, it can be a little bit longer. I hope that this has kind of explained to you a little bit more about what craniosacral therapy is about. If you have any other questions, give us a call or email us. Thank you.